Hello, everyone. Welcome to Monday afternoon. We're going to talk about the RAP PSR promising practices for supporting settlement during COVID-19. We are expecting a few more attendees, so we do want to give just a couple more minutes, probably only 2 or 3 though, not even 5, and then we'll get started. So I just wanted to let you know that we're here, we're online, and we're just waiting for a few more people to join us. So welcome everyone. Thank you very much for spending your Monday afternoon with us. We have a very promising discussion ahead of us, and I just wanted to let you know that we may have one of our presenters joining us late. As I'm sure you can imagine, the people we have joining us today have very demanding schedules, and one of our presenters may end up having to join us late. I am Christina Hamer from the Refugee Sponsorship Training Program, and I'm going to go through the control panel with you before we start, but I would like to just introduce Laureen, and who you can't see on screen right now, Michelle, who have organized this presentation, thankfully, to share, so that we have the ability to share information on supporting resettlement during COVID-19. I know that we've all been asking a lot of questions, and now it looks like we're going to be able to get some meaty answers from people who have had some firsthand experience. Now, before I do that, I just want to make sure that all of you attending have an idea about the control panel. So I'm going to share my screen with you so that you can see the slides. So you should all have on the right-hand side of your screen a control panel that looks something like this. Now, it might not be entirely out from the side. You may only be able to see the bit that has the little red arrow, the little microphone, and the hand symbol. If that's the case, you can click on the little red arrow and this whole panel should pop out from the right for you. On your panel, you should have control for your audio, and you should have a questions box. And I just wanted to let you know that during this hour, if you have any questions, you are more than welcome to type them in the questions box. And we will have a question and answer period towards the end. Also, if you are having any trouble, any technical difficulty, if you can't see the slides that I'm talking about, you can also put your comment in the questions box and I'll be able to see it and take care of it. So that is your control panel. When we get to the question and answer period towards the end, you can put your questions, as I mentioned, in the question box. You can also, if you have a microphone, speak your questions aloud by clicking on the little raise your hand icon, at which point I can unmute you and you can voice your question. Okay, so you have a couple of options here. For now, you're all muted while we're going to have the presenters presenting, and then we can unmute if you want to voice your questions. So I'm going to turn it over now to Lorene, and excuse me, I'm just going to make sure that I have Lorene on video. Hi, Lorene. Can you hear us okay?
Yes, can you hear me?
Yes, great. So we're doing well. So I'm going to hand it over to you, Lorene, and I will go through the slides. If at any point you can't see the slides, let me know.
All right.
And I'm just
good.
going to turn off my camera.
Thank you so much, Christina. Hi, everyone. Welcome today to our webinar. We are looking at today, we organized today because we really wanted to learn from the Resettlement Assistance Program agencies, otherwise known as RAP agencies, and their RAP COVID task force to see from their experiences what they are seeing on the ground and receiving government-assisted refugees under the pandemic. So we want to discuss the opportunities, the difficulties, the practices, and learning opportunities that we can adapt from the RAP agencies as we plan for the resumption of travel and for privately sponsored refugee arrivals. So that is the overall goal of today, to ask any questions you may have or discuss with our panelists what they are really seeing and what we can learn from what they are seeing. Okay, so to go over the flow of the call, we will be listening to hopefully 3, but maybe just the 2 panelists currently. And then we will open a period of questions directly to the panelists. And after that, we will be having an open discussion and then the next steps. Okay, so that's the overall agenda. Again, if you have any questions, please feel free to either raise your hand or to type it in the question box. A kind reminder that we also have some handouts. So under the control panel, if you click handouts, we have both in English and in French some of the RAP Task Force handouts, resources, the PowerPoints and the checklist that they have developed. And you can take a look at those as we move forward with the presentation or afterwards. Okay, so thank you very much for your time and your attendance and your patience throughout all of these webinars and learning opportunities. I hope you find it interesting and helpful as we move forward in this exciting opportunity. So I would like to first introduce, all panelists. I think you have your videos on. I can see you. You will have 10 minutes each, and then the question and answer will be after everyone speaks. So I would like to first introduce Nawal Al-Busadi, who is the Director of Hostel and Refugee Services at Costi in Toronto. Welcome, Nawal.
Thank you very much, Lorraine, for welcoming me. And thank you, everyone, for taking your afternoon time to listen to our best practices. So as Lorraine said, Costi is a CAR agency, and during the pandemic, we're talking between March 16 all the way to May, we have been receiving emergency arrivals to Canada, specifically to Toronto, that we had to adjust our practices and our protocol to be able to support them during this process. And in total, we have received 19, and from May till last week, we have received an additional 19 new families. So how did our services change? So with the requirement of isolation, self-isolation for 14 days, we have housed all our arrivals in a hotel room, and we have facilitated the self-isolation process there. with 24-hour staffing on site and with the cooperation of the hotel services in terms of housekeeping and meals. We've managed to ensure that the clients observed the self-isolation. The clients were able to be supported on site through virtual support with our staffing being on site, as well to ensure that the clients get daily screening in terms of any COVID-19 symptoms, and after 14 days, ensuring that our client got tested. Now, if some of you are familiar with the Costi Refugee Division, we manage over 1,700 individuals in our division who receive services on a 24-hour basis. So our services are considered essential. And we have over 120 staff. And I can tell you, since the pandemic has started, we have done multiple testing in all our locations, and our staff have tested negative. Unfortunately, we did have some clients who tested positive in our hostel services, but not in our RAP. Again, just considering the volume of individuals in one location and the sort of geographical as well as the structure of some of our buildings in some of the location. But in terms of how we adjusted, I think it's key for us to mention that the protocols were designed with frontline workers in mind. We did multiple consultation when the outbreak became public. And in terms of the COVID-19 in early March, we had multiple meetings with our staff, with our senior management. We had partnered with Toronto Public Health early on to really determine what kind of protocols do we need to put in place. Everything from ensuring physical distancing on our sites, ensuring the gloves, reusable gloves are used in terms of handling transactions, ensuring that we had face masks. I know it wasn't mandatory at that time, but we were proactive in ensuring that everyone on site, including staff, had face masks at any given time if they couldn't ensure physical distancing. We increased our level of hygiene in our location. And in the isolation sites, which is an overflow site, meaning the hotel, we ensured that, yes, staff were on site on 24 hours to monitor the families who were in isolation. The contact between the staff and the family continued to be virtual. And only in urgent cases where clients had to be transported to for medical appointments or other urgent appointments, where full PPE, and I mean face shield, a mask, a gown, and a glove had to be worn by staff, and a face mask had to be given to all clients upon arrival, had to be worn to ensure the services were delivered. We limited our face-to-face interaction as much as possible. We did meal drop-off to our clients in their rooms. We did snack refills to our clients in their rooms. We ensured that clients had access to telephone and internet while they were in isolation. We also ensured that their laundry services were collected on a daily basis by the hotel staff under the agreement that we had with them, and handled according to the protocol with Toronto Public Health to ensure we mitigate the spread of the virus in the hotel. So with that, we really had to shift our work completely and ensure that virtual work is the way to go with our clients, even though they are on site, including as they move to the reception center.
Okay.
Lorraine,
Thank you so much, Noel. Sorry, a little bit of a delay. Online hazard. Thank you so much. So interesting. I'm sure we have participants who will have questions. So please remember them or write them down, and we will get back to you, Noel. Next, I am going to introduce Chris Friesen. Chris, are you there?
I am,
Great.
yes.
So he is the Director of Settlement Services in Vancouver. He is also the co-chair of the National Settlement and Integration Council and the chair of Canadian Immigrant Settlement Sector Alliance. So lots of hats for Chris. Thank you so much for coming, and I will pass it over to you.
Thank you very much. So greeting everybody from sunny Vancouver. Not as warm as folks back east, but nonetheless, it's a lovely day here. I'm also was the co-chair of the RAP response team that was structured at the end of March. So I'm going to share with you, walk you through very quickly a couple of documents that were created that may be relevant aspects to you as private sponsors. So could I get the readiness checklist up first on the screen? Great. So we realized at the end of March that we needed to put in place some guiding principles, understanding that these would be works in progress and would change, and that provincial health authorities would dictate local conditions, additional local conditions. Um, so these documents were created by, as I said, a response team of RAP agency representatives, IRCC, IOM, and they were developed over a period of weeks through a consensus process. I want to point out that they are works in progress. They are going to evolve over time with updates as new information becomes known to us. But these documents are divided into 5 components, starting with a point of entry. And really, it is all about readiness before your sponsored refugee arrives in your context. In our context, government assisted refugee arrive. It's understanding what's going to occur and ensure that to the best of your ability, again, maintaining following guidelines of local, provincial, territorial conditions, exactly what needs to occur. We can go up a page. So again, some of the things that Noel spoke about on the front line of receiving government-assisted refugees over the past couple of months, similar to us here in Vancouver, we've had 3 families arrive over the course of the last 2.5 weeks. Is just around the personal protection equipment, what is necessary, make sure you have that in place, that you're cleaning your accommodation or offices appropriately. So these are all sort of helpful hints that can be modified and built upon your local conditions. Yeah, you can carry on down to the, yeah. So for us, assistance in looking for permanent housing, again, what does staff need who are supporting government-assisted refugees in this context to look for housing? What should they be wearing? What certain aspects of orientation to permanent housing should take into consideration during COVID. So again, these are just a bunch of questions that allow you as the reader to review, to make sure that you're following correctly. During self-isolation, the 14 days, as you said, we here in Vancouver have been issuing each of the government-assisted refugee a cell phone upon immediate arrival. So that's how our staff are keeping in touch with them 24/7, is through a cell phone during that time. Our reception house is based on self-contained apartments, so food, groceries are delivered, which they will cook during that time. If they need laundry, it's done on an as-needed basis. So these are all sort of the different components and different things that are happening across the country. And then you can scroll up. The last page is in the context of government-assisted refugees and the settlement case management process, is again looking at ways to offer support and services through different means, virtual, limited in person. what happens under certain circumstances. For example, if a single mother with a child, the single mother becomes ill, you know, the safety protocols. So it's about considering all of these different variables um, to ensure that there are safety plans in place, protocols and procedures in place. And it's about the flexibility to evolve as situations come up. Can you put on the other document, please? So this it was the other document that was created by the RAP response team. So the delivery of critical services to GARs during the COVID. So again, following the same understanding of 5 key phases from pre-arrival to post-arrival. This gives you a sense. Pre-arrival, what happens at port of entry, under the temporary accommodation, whether that's a reception house or hotel, permanent housing piece, and then post-RAP and the settlement case management and ongoing settlement supports. You can go carry on. Okay. So again, this was really important, the pre-arrival and understanding from an IOM perspective, what was happening overseas. Would, in this context, GARs be arriving with PPE? What would happen if prior to departure, they became symptomatic? Just understanding the process, understanding what pre-arrival orientation they might receive, and the extent of that was what happens during flights, if they have to change flights and so forth. So this gives a sense from IOM's perspective what they were following, again, through these changing process. Point of entry, really important. We had both Vancouver and Toronto point of entry service providers on our response team. And again, walking through exactly what would happen for their staff, for government assisted refugees, and for that matter, privately sponsored refugees. So from the arrival hall, what happens, for example, if a refugee arrives symptomatic? You know, what happens to that individual or that family vis-a-vis quarantine, vis-a-vis medical attention that may be needed? All of these things we were trying to anticipate and document so that everyone, all RAP providers across the country, had a clear understanding of how, subject to change, how individuals would be supported and helped and processed during that time. You can go down further. Thank you. So temporary accommodation, again, you know, looking at everything from government-assisted refugees to also one-year window, very much following the Public Health Agency of Canada and local health authority. So again, although refugee resettlement has resumed, there are some parts of Canada that are not open yet. For example, Newfoundland and Labrador. So again, these points are meant as guiding points, principles, protocols in the development of understanding of national approaches to these, taking into consideration, of course, local context. You can scroll down a little bit more. So, as I said, it's really important to support the families during quarantine. If families, particularly those with young children, are you know, going to be behind walls for 14 days, we were looking at ways to entertain the family beyond just the television. Toys, books for children that of course that would have to be thoroughly cleaned afterwards. This was a way in which we reached out for donations and so forth, care packages. Those cell phones were key. One of the things that we haven't had to address now, but it's on our, you know, critical list of, okay, how are we going to deal with it if it comes up, none of the families that we've received to date, none of them have had any smokers. Smoking will be very complex within a COVID 14-day situation. We haven't had to cross that bridge yet. But this is something that we're trying to figure out. If people are not allowed to leave their suite or their apartment or hotel room and they're smokers, we haven't figured that one out yet. What happens? Because I can only imagine going cold turkey in the middle of a pandemic probably is not the best timing under all the other stress. You can carry on down. So transition into permanent housing, again, mindful of, having to use public transit in order to show families permanent housing options. Again, so working with landlords, ensuring that you have your PPE. All staff, the clients, as I said, have cell phones. So this has become critically important to understand is the issuance of cell phones for clients, government-assisted refugees, as soon as they arrive. Okay, coming up. The other thing too for government-assisted refugees, as you've already heard from my colleague Kosti, we are providing government-assisted refugees with PPE. Here in Vancouver, we are issuing each family member, all children 2 and over, with reusable fabric face masks as part, and various other PPE supplies as part of their move in and move out into permanent accommodation process. And here, stage 5, the post-RAP, settlement case management. So what happens essentially when they leave temporary accommodation? And this is where, again, we've tried to highlight different issues that may arise, how to approach those issues. One thing that I haven't spoken to about has been around mental well-being. When you're socially isolating individuals for 14 days, and depending on their pre-migration trauma, post-traumatic stress, and so forth, we have also here in Vancouver put in place periodic mental well-being checks by a registered clinical counselor who can just support in a non-clinical way some transition, culture shock, other things that may avail or surface during that initial 14-day period. Okay, carry on down. And I think that's it. So that in a nutshell, these documents, as I said, I included them as part of handouts. You may want to take a close look at that again and see whether in anticipation of privately sponsored refugee, whether there are things in there I think that could be helpful for you as you plan it, particularly around the quarantine, around how to deal with medical emergencies, cell phone, how are you going to deal with smokers, family emergencies. This is all, there are some suggestions in these 2 documents that may be helpful to you. So I'll stop there and take questions.
Okay, great. Thank you, Chris. So we do have a couple of questions, but I have heard that our 3rd panelist has been able to make it. Carl, are you able to turn on your video? See there?
There he is.
So we have Carl here from Reception House in Kitchener. Hi, Carl. Thank you for making it. I know it's a bit chaotic, but thank you. And I'm looking forward to hearing the presentation.
Well, I don't have the formal presentation. I heard the tail end of what Chris had to say, and a lot of what he had to say is very much similar to what we are doing. Chris and I were part of the COVID task group that IRCC set up, and we developed the small group that was a part of that group developed the protocols. A lot of what Chris has spoken about. I think that I guess for me, what is needed, one of the other issues that we have kind of dealt with as part of this is not only some of the issues that Chris spoke about in terms of smoking and some of those other things and PPEs. Very much like Chris, we have set aside a set number of PPEs for clients and families, and part of that was provided by IRCC, and also part was donated to us. We have, as part of a welcoming package, and we had a donation of face masks, sort of cloth face masks that we are making part of a package for all sort of new arrivals. I think one of the issues that we have had discussions about is people who have arrived and must be isolated and have family members in the general community. So we've had a family, as an example, who had families in Guelph and wanted to come and visit, and having to really stress that that wasn't something that was a good idea. We don't want to be police, but at the same time, we have to kind of reinforce all of the guidelines and the protocols around the 14 days isolation. We are using a local hotel as part of that process. And then after the 14 days, they're coming to our reception center. We have been trying to ensure that we have a kind of support for people. We're trying to sort of mitigate against any sort of people breaking the rules, and that's a challenge. We are trying to think of all of those situations where things might come up, and how can we support not only our staff but those people who are new to the community. We have a staff person very much like Chris on staff. She's our sort of mental health, our wellness navigator, and she's been doing a lot of work with our clients who are not only suffering through kind of what experience they've had in terms of mental health, but now coming into this sort of COVID reality, are having challenges. So we have sort of protocols in place that support people into their mental health. We are partnering with another organization in the community that provides mental health support for sort of frontline workers. And so we're trying to also get our staff connected to that kind of support. But clients facing staff, particularly who are going through their own sort of challenges. So that's a very quick sort of response to some of the things that Chris had mentioned, and kind of what we're doing is very much in keeping with what Chris has outlined as part of his presentation. We have a lot of material that was developed as part of the COVID response task group that we can share with, and I think Chris has already shared some of it, but that is very transferable in terms of the people that you serve. That's a quick overview. I'm
Great,
sorry I missed the first bit of it. Getting caught on the highway and accidents and redirection of traffic has been a real challenge.
Of course. Thank you so much for your time, Carl, and sharing your experiences. Just looking at some of the questions, we do have a lot of more technical questions of the costs that IRCC are covering for some of this extra equipment and COVID requirements. In case anybody is interested, there was a webinar last week between RSTP, the sponsorship agreement holders, and IRCC, and they recorded the webinar, and it's available online in the chat if anybody would like to see the whole webinar. There's a separate conversation with IRCC happening between those groups, in case it answers some of the more technical questions people have about the costs and associations with IRCC. Other question about the resources that Chris was showing. They are under the handouts. If you go under the control panel, you click the arrow pointing down. Under handouts, you'll see 5 of them. They are in French and in English, and show the checklist that Chris was talking about and showing us, as well as another PowerPoint. Okay. All right. So for questions to our panelists, Serena is asking Nawal, who carried out the testing at the hotel and how was it done?
The testing was done in the reception center, and it was done in partnership with Toronto Central LHIN, Toronto Public Health, and Health Access. And with that, they did it in the reception center, and it was done for staff and all the GAR residents at the reception center.
Thank you.
In our case, we have a partnership with the Center for Family Medicine. They are our kind of a health partner, and they do the testing at the hotel. They also provided a couple of weeks ago training for PPE training for staff. So all of our staff went through PPE training, how to take off of the put on, how to administer with clients. So we have done that piece because up until then we were kind of, working our way through it just based on how the equipment looked. But to have formal sort of training by a nurse practitioner did that helped our staff a lot, so that they know what are the correct ways to put on the equipment, and also to ensure that the clients put on the equipment in the correct way.
In the BC context, oh, go ahead.
And just as a general information for everyone, not necessarily in Toronto, Toronto Public Health has this information and training online, and it's been accessible as of March 16. So you could actually direct your staff, even your clients, even your partners online, to be able to access those virtual webinars in terms of PPE usage and discard of PPEs.
In the BC context, we're not doing mandatory testing according to our local public health authority. So once the 14-day quarantine is completed, they will, and they are provided with their 2 reusable face masks and some disposable face masks with instructions, guidance in first language and how to properly use them. That earlier question about where do the resources come from? So RAP providers were not provided with any additional funding at this point. This has all had to been used or reprofiled within our pre-existing contribution agreements. But in the case of PPE, most RAP providers will now have in place around 4 to 6 months of PPE, various from the face mask to the overalls, face shields, etc., hand sanitizers, were sent out through the regional offices to all of the RAP providers. So, but in some cases, as you've heard, additional PPE like the reusable fabric face masks have been sourced locally.
Thank you very much. Our next question ties into that, but before departure. So do you know what the IOM is doing before departure in terms of education and providing PPE?
So the IOM, go ahead, Chris.
No, you go ahead.
I was going to say what you said because I was in the call with IOM last week. So I guess we all have the same information, but go ahead, Chris.
No, you go. You go.
So
Go ahead,
honestly, it is very important to reiterate to everyone that communication is key, and echoing the information to the clients is very important. So IOM, unfortunately, with COVID-19, doesn't do the entire session, but they were able to provide essential sessions for clients coming in. And with that is discussion about the self-isolation requirement upon arrival, discussion in terms of symptoms, if they have any COVID-19 symptoms. They'll talk to them about the accommodation, and that the accommodation for self-isolation will be provided by the SPO upon arrival. They also talk to them about the PPE and the use of the PPE. But also upon arrival, IRS from the airport actually provides, people come in with their face masks. We have to remember, people are well informed, people are aware of COVID-19. A lot of the airlines don't allow passengers to board their plane without face masks. But upon arrival to Toronto, they go through screening to, mitigate if they have any of the symptoms. But then IRS actually provide them with face mask and provide transportation to the SPO if they're coming to Toronto in our scenario. But if they're transiting in Toronto to fly to their final destination, they are housed in a hotel for a day, and they are instructed in terms of the self-isolation and the resources they need for the day, and then they continue their journey. Some of the arrivals that came in, the emergency arrival that came in from April to May, who were destined to other areas within Ontario, they were transported by taxis or special transportation that had they were equipped to handle clients during COVID-19.
Thank you very much. Chris, did you need to add anything there?
No, just that I think the overseas conditions vary significantly. So there's no generic IOM approach, but as Nawal has said, there is communication between the refugee and IOM staff before they get on the plane. If they are symptomatic, they will not be flying. But it is the local conditions overseas, vary, and so IOM is really having to respond to the local condition and authorities through this period.
Okay, great. Our next question is from Layeth. Did they stay longer than 14 days at the hotel? So our arrival staying longer than 14 days at a temporary accommodation?
We had one family that stayed longer than 14 days, and that really to address Carl's comment early on, where we had a family that was is called under the UPP, and they had a family friend in the city that sneaked into their room, and we actually caught them leaving. So we had to, they were on the tail end of the 14 days, and according to Toronto Public Health, once they're exposed, we have to add another 14 days. So in those scenarios, yes, we did have people stay longer than 14 days. But honestly, with everyone that we've received so far, it was 14 days in isolation in the hotel and back to the reception center. But the scenario at the reception center, they're not in isolation, but they maintain physical distancing. There's no congregation of groups. People stay within their room. They go out to run errands. They go out to do grocery if they need to, but maintaining physical distancing and our COVID-19 protocols on site as well.
And in the Vancouver context, because we have a reception house like Costi within our offices, but they're self-contained apartments, they will stay longer than 14 days. Once they've completed their self-quarantine period, that is when we actively start the permanent housing search. So individuals are likely staying with us anywhere from 4 to 6 weeks in temporary accommodation these days.
Okay, great. So a question for any or all presenters. Did IRCC expect RAP providers to assist newcomers in quarantine to open bank accounts online? If you have attempted this, were financial institutions able to provide that service?
Absolutely. I mean, we are expected to go through our regular RAP orientation sessions within the timely manner. And as I mentioned earlier, we really moved our services virtually, where we open bank accounts, we apply for SIN numbers, we apply for health cards, we do virtual house search for our RAP, our GAR clients. So everything has had to be adapted virtually. And as Chris mentioned, and Carl, for some clients, we had to provide cell phones, we had to provide access to the internet to facilitate those virtual transaction and support.
Yeah, absolutely same.
Our next question ties right into that then. Who pays for the cell phone provided to the clients? Do you get to keep them, or do you retrieve them after a certain amount of time?
In the Vancouver context, we have a partnership with TELUS. So TELUS is providing refurbished cell phones that are made available just prior to the government-assisted refugee arrival. The government-assisted refugee is charged $30 a month communication costs for their data plan. That $30 is negotiated, was negotiated some time ago. That follows the RAP communication allowance. So they're issued their phone and they keep it.
Yeah.
Yeah,
with us is similar. We have similar situation with Rogers, and basically they're charged $30 a month and they get that same. So it sort of works out fairly well. We had through the Kitchener Public Library over the course of the last few months, they had sort of 20 Chromebooks that they were not using that they loaned to us. So we loaned the technology to clients, and then also provide kind of orientation to some training how to use, if they didn't know how to use internet. So we used those Chromebooks up until last week. The library has reopened and they want their Chromebooks back. So right now we are loaning Chromebooks to clients that we have purchased. They are using those Chromebooks to connect to banking and to connect to services that we are providing, and also remote services that other agencies are providing.
In Toronto, it's different. We do not have, we loan the clients cell phones, and we provide them with $25 SIM card during the isolation. But once they're in the reception, we have telephones and computers accessible for them.
Thank you. All right, so our next question is from Leith. Chris, you touched on this previously, but when did you start taking them out for viewing in permanent accommodation? So if the other panelists have a different answer, please let us know.
Yeah, so we don't start that process of permanent housing until after the quarantine, the 14 days. So we have housing search staff that are, of course, understand by unit size, are beginning to look for places. But it's not until they've left quarantine that we can line up in-person appointments with landlords, etc., to see places. So that process is delayed. During the quarantine, we have also, again, we will begin some of the paperwork process in a safe manner. So, ensuring that we have copies of their legal documents and where, numerous forms have to be completed. We'll start that process and figure out safe ways of getting the clients to sign these documents so that we can start processing provincial healthcare coverage and PR cards, etc. So there's flexibility in that, but it's first and foremost is to ensure both client and staff safety.
In Toronto, the scenario really varies depending on the complexities of the clients we receive. So in Toronto, we have high complex clients with high medical needs. So the priority for us is really to ensure that they have the medical support needed, and housing is really not a priority for them. But in terms of people others who we've managed to provide them housing after the isolation. In Toronto, all our housing search and viewing is done virtually. So a lot of our landlords have adapted the virtual views of homes, and we've managed to ensure that clients pick their housing through that method. It hasn't been easy, and as the housing crisis in Toronto, a lot of our clients do not end up living in Toronto. So we have a lot of our clients moving out to London, to Mississauga, to Brampton, to Pickering, Ajax. So they're moving to outskirts of the city, where rent is affordable and is accessible for them. But have been challenges though.
I can imagine. I just had to find a place online and it was not easy as somebody from here. So Jennifer asks for Chris, do you know if the type of testing that Costu was able to organize for their site, do you know if that type of service is available on request here in BC, especially for privately sponsored refugees?
The COVID testing is available, but we're not doing it on a systematic basis. But if there is an individual that may be symptomatic or so forth, we have very easily arranged for that. In our situation in Vancouver, there is urgent and primary care clinic, both in our Vancouver and our Surrey site offices, and they are able to do COVID testing on site. So that is available.
Okay, great. And from Jennifer as well, Carl, are you able to share the Wellness Navigator protocols used to engage with the newcomers?
Yes, yeah, I can. It's I'll have to look at it and get it to you, but it's part of a sort of overall protocol that we've developed. We have two staff whose job it is to. We have a staff who's a sort of a mental health wellness navigator, and we have a staff who's a sort of health navigator who works really closely with the Center for Family Medicine. And we have tried to, I guess, develop protocols that are organizational. It's not just per position, so that staff have knowledge on how to sort of interact, and they continue to do that during this period, and we continue to try to reinforce the way we've done it. So what we do as a staff group is we have sort of a Google Docs document that we use to sort of keep alive. We have a framework, and then we sort of add to it as we find out sort of new information, or we learn something new. And our senior leadership team, we review it kind of once a week. We have Tuesday morning meetings for an hour, and we review that kind of information to ensure that we're keeping everything up to date. So the basis of it is the framework that we developed that is part of the COVID task group, and the enhancement is just everyone has learned something new every day about COVID, and we try to keep it updated through using this process. So I will look to see how I can get it to you, and you can share it with folks who might want this information.
Okay, thank you so much, Carl. Our next question is from Kaylee. Could you ask presenters to speak more to considerations and protocols they are thinking about if a newcomer breaks quarantine and how they will handle this? Some of the sponsorship agreement holders are concerned about how to prepare sponsors and SAWs on how to handle this.
Yeah, that's a very good question. I think we've had some discussions about that actually. Some of these conference calls and some of these discussions we've had, and I'm not sure if there's one answer. I think that I think you make the assumption that IOM does some orientation, and then it happens again at the airport, and then it happens when we meet firstly with people I think we have to just keep reinforcing how important it is for people to be in quarantine and to follow the protocols. You know, sort of knock on wood, we haven't had any one sort of breaking the rules, but we have, you know, when we knew that there's a family sort of nearby, we tried to reinforce the fact that, you know, when the family calls and wants to come and visit, tell them they can't come, because it's hard for us to police people. And if they break protocol, sort of what do you do? I mean, you got to say, okay, that means that you have to start the process over again. So it's not going to be 14 days, it's going to be another 14 days, it's going to be 28 days. So it's important for you to understand that you've got to follow the rules if you want to be able to sort of interact with your family members sooner. So I think it's just more sort of discussion and orientation with people rather than sort of policing, because it is hard to police. It's hard to police that.
Yeah, we were pretty clear at the very beginning that you know, technically speaking, they will be under a surveillance. We have security cameras, and we stretch it a little bit, but we tell them that you know, these cameras are on 24/7, and if you break the protocols, you know, that it will extend your time in self-quarantine, and it may jeopardize your stay in the facility. This has been discussed with the IRCC.
Thank you very much. Before I go on with the written questions, Christina, can you see for the hands up? I'm not able to view who they are.
We did have 2 hands up. One of them is Roya, who also wrote her question, so I expect that that one's taken care of. And then we had another hand up from Don Schroeder, but I'm not sure if he's still online and wants to ask. So Don, if you are still here, I still see your name listed. You can unmute yourself if you'd like. You should be unmuted from our side, and you can unmute yourself and ask your question. There should be a little microphone toggle on your conversation panel, on your panel. It shows on my side that you're self-muted. Lorraine, why don't you go ahead with another question, and I'll let you know if Don's able to unmute himself.
All right, thank you. So our next question is from Nova. Do you have to wait for 14 days to pass in order to start applying for your health cards and banking, etc.?
No.
No.
You can start that right away.
Yeah.
Great, nice and easy. All right. Our next question is from Larry. Are service provider organizations available to assist with the reception of refugees for private sponsorships?
Yes, and we have been helping organizations in London who have reached out to us. We're more than happy to share some of our resources, some of our best practices with those organizations who need our support.
We are in the process.
Sorry, we're very much the same. I think we've had a discussion with MCC, and we're looking to see how we could support private sponsors, and you know, we're open to working to ensure that, you know, we all want to have a healthy community. We want to ensure that those people who are new to the community start off on the right foot, given this very difficult time we're in. So we're very much open to working with privately sponsored folks.
And I think this will depend, not so much that we don't want to help, but it'll depend on the local context. So here in BC, as an example, we are beginning to resume the opening of our offices on July 27th to client appointment on a appointment basis only. But on our website, and this will be the same for other organizations, we have developed centralized intake processes for new clients, including PSR clients, for our language classes, employment settlement, so that there is one number, one email that they can reach out to regardless of the office. But as far as in-person services, in our context, that will be available from July 27th onward.
Okay, great. Thank you. Don, are you there? I thought I briefly saw his name.
Yes, he was able to unmute himself and then he muted himself again. Go ahead, Don.
This is Joanne Schroeder. Can you hear
Yes,
me?
he was able to yes, we can hear you, Joanne.
No, this is Joanne Schroeder. Can you hear me?
Yes, we can hear you, Joanne.
Okay, this is coming delayed.
Yes, we can hear you, Joanne.
Can I? Okay, this is coming delayed.
Joanne, go ahead and ask your question.
We're a group of private sponsors, and we are wondering if we can get the webinar apparently that came last week that addressed the private sponsor program. And we thought that this was going to address this today or give us some information, because we do have things in place. And we're just wondering if our people that we're waiting for will have to isolate in a hotel, or can they isolate in the provisions that we have for them in their new home here?
Lorene, I can probably address this.
Go ahead, Christina.
Yeah, and I would say that they don't have to be isolated in a hotel. If they're going directly from the airport into a home that you have secured for them, that's where they isolate. I mean, that is something we had looked at doing as well. Part of the challenge with finding people permanent housing before they do temporary housing is a lot of landlords are not willing to do that at this point in time. So part of our plan was to have people go directly into permanent housing, very much like you folks do, the privately sponsored people do, but a lot of the landlords that we've dealt with, whether they own housing or their apartments, didn't want to do that. So, but that's a good plan. So you miss a step or you delete a step and you can more closely monitor what's happening in your community. So you don't need to put people in a hotel.
And I can add to that. So the information that we also have at RSTP is the same as what Carl has suggested, that it is possible to have people in places other than hotels. There was a webinar last week on Wednesday for sponsorship agreement holders. There's also going to be a series of webinars starting, I believe, sometime just after the 23rd, that's going to be actually through, again, the RSTP platform here, and we're going to have multiple webinars across Canada. So there'll be more information coming up for you, Joanne.
Yeah, I think the other thing I would say, Joanne, is that as you've heard, what's critically important is ensuring that you have a quarantine plan, a self-isolation plan, because what the government has been very clear about is that they will do spot checking to make sure that the individuals are where they're supposed to be in self-isolation. And we've had in one case a government check 5 times to ensure that the individual was where they were supposed to be. So the key is to have a plan and to follow that plan, and be mindful that government may check in to ensure that the plan that you have stated is being followed.
And I just want to clarify the rationale behind us costly using hotels is really, we don't have our design, our infrastructure in our reception center is a shared accommodation. So we only have 3 rooms that have isolated sort of individualized washroom. So for the purpose of isolation, we need people to have their own washroom, their own spaces. And this is why we resulted into overflow, where we used hotels to provide the self-isolation.
And that's identical to us. We have only one room that's self-contained, and so we chose to use hotel basically. And this is a hotel that we've used when we've had overflow, and they're very aware of our client group and are very supportive of the work. So it's easier to do it that way.
Great. Noel, this question is for you. Would a privately sponsored refugee sponsor contact you for support? What kind of support would you be able to offer?
Absolutely. As I've mentioned earlier, we are helping other private sponsorship refugees group in Toronto and outside. And I'll connect them with our general manager, who is working on site and on location in terms of the protocols, everything from upon arrival, how do you deliver virtual orientation, how do you deliver virtual services, what equipment do you need to have in place, how to run testing for your clients if they are asymptomatic. I just want to clarify that a lot of our clients that tested positive in our hotels, not in the GAR program, were asymptomatic. So with that, we've done daily screenings that we do with all clients on a day-to-day basis to ensure that our testing is actually a proactive mechanism to isolate people who are asymptomatic. So we'll be able to help them in ensuring that they have things in place before arrival, but also how to monitor and support upon arrival.
Thank you so much.
That would be, so that's a good point, that it really will depend on your local health authority, right? So in the case of Toronto, you know, they're doing much more testing versus other parts of the country where that isn't the protocols. So you really have to, wherever you are in the country, really have to follow and understand the local health authority health protocols.
Thank you. So Roya, your question was, has there been many arrivals? If so, which country?
So I think, I don't know, Carl, how many have you received? But we have received 19 as of March all the way to May. And from July 2nd to date, we have received another 19. So we've received families from Pakistan, from Somalia, Rohingya, some Turkish. Earlier on, we received urgent protected people. I don't know if you know the category, but they were coming from Mexico. Many of them are Latin speaking. So before the border, well, before the airport was open on July 1st, a lot of the cases that we received were urgent protected people, and many of them came from Latin America, and they were Spanish speaking individuals.
In our case, in Vancouver, mostly Somalis and one urgent protection case from Honduras via Mexico.
Okay, great. Thank you. So, Michelle, are you there?
Yeah. Hi. I just put something in the chat just to say, I think in response to the question about the purpose of today's call and what information we're able to share and about what information was given. So I just wanted to clarify that I put in the chat box a link to the webinar that was done last week. And so for those who are not joining, that's a really good resource so you're up to date on the information that IRCC has been sharing so far. And I also wanted to share that, you know, the point of today's call was not so much to tell you the official kind of quarantine planning or anything like that, but to really learn from our colleagues who've been doing this day to day and see what we can kind of, you know, learn from their experience as we move forward as a sponsorship community. So yeah, that's kind of why today is not about these official kind of PSR resumption resettlement planning, but really learning before we move forward into planning. So yeah, just wanted to let people know that's in the chat.
Okay, Thank you, Michelle. So we do have a couple more questions, but I'm hoping they'll come up in the discussion because we do need to move forward as we're running out of time. Can we put the discussion questions up, Christina? Great, thank you. So to reiterate, as we're trying to learn from the RAP agencies, we wanted to base a discussion around what do you need in your organization, those of you attending this webinar, to be able to be ready to receive the privately sponsored refugees. What are the gaps that you are seeing? What are the opportunities? What resources and actions are needed in order for your preparation? So if we could have any hands up for people who are willing to speak and share their experiences, please do so in your control panel, and Christina will be able to allow you to speak.
So I don't have anyone volunteering yet.
So then I will go to one of the questions that we have. We are getting a lot of questions about if privately sponsored refugees will be able to go to reception centers, and if so, who would cover that cost? So are they allowed, firstly, and secondly, who would then have to pay for privately sponsored refugees?
So in BC, in Vancouver anyways, we're saying no. That's one area we cannot help you because like everyone, we have had to develop our own safety plans for the organization to mitigate the risk. And so the use of temporary accommodation to provide PSR quarantine is one area that we cannot offer. We can offer support in other areas, whether that's banking and and so forth, orientation, that sort of thing. But when it comes to providing temporary accommodation for PSRs in quarantine, that's something we can't in BC.
Yeah,
In Toronto,
we've had discussions about that, and I think, but the fact that we're using hotels suggests that, I mean, even with if you have one family, it might be easier for us to put them in temporary accommodations if they're the only ones there, but that's a big space for one family, so it's easier to manage the process for all the reasons that Chris said. For us to use a hotel, and so we have been, looking at how we can support sort of the folks that we serve and anyone else, and temporary accommodations. In our case, in Kitchener, is not the best place to do that. So, I mean, we can help connect you to the hotels that we use because we have a history with them and we have a good working relationship and a good deal for rooms. We can help facilitate that, but we can't put them into our temporary accommodations.
Yeah, and we could do that the same. Yeah, we could do that the same. If you want leads into outside boarding contacts, in our case in BC, that have self-contained units that we focus our program in, we're happy to give you those, but not for the housing within our temporary accommodation facility.
the same with Toronto, we can't.
Okay. And then I will direct to the panelists the second discussion question. What opportunities for collaboration then with RAP organizations and other organizations can get us ready to resume resettlement of privately sponsored refugees? What can everybody offer to the table here?
Yeah. So I think it begins with understanding within your local contacts what is open for what type of service, what, assessing the local immigrant serving agency that would be available to privately sponsored refugees because they are permanent residents, but just understanding what is being offered virtually online, and in more and more cases in parts of the country, the resumption of some in-person services. Most immigrant serving agencies will have updates posted on their website, so that would be another logical step to look at and determine what offerings are currently there. And I would also like to say that there are a number of agencies across the country that are doing more work around the whole notion of digital literacy and access to technology, of which privately sponsored refugees who are challenged by digital literacy would also be eligible to join, whether that's a classroom, workshops, etc. Most providers, I understand, correct me if I'm wrong, any of my co-presenters, most providers that deliver language instruction for newcomers to Canada continue to offer that online only, and that the resumption of in-classes likely will not start until the fall, late September, is what I've been hearing. Although in some communities they may offer reduced class size in person.
Yeah, we part of the work we're doing, not our not a language training like LINK, but we have some work that we've been doing around employment, helping folks to find employment and providing language training on the job. And we're working with the college. The college does the delivery of the language component. And it used to be on the work side, and now it's virtual. So the college has taken all of what they've been doing and they've made it virtual. And I think that's what's happening with some of the other language providers. In Kitchener, as an example, it's the YMCA that provides the LINK classes, and they have just restarted providing that service, everything except the written piece. So the grammar and the language, all of the assessment, they're still doing the language assessment because that was on hold for a long time. But they've restarted that. So a lot of the organizations have restarted the services and are doing those services virtually. And in some cases, as Chris has talked about, sort of digital literacy, sometimes that's the first thing you have to do is help that family or that individual or that person understand how to use the technology before you get them working on whatever the issue is. So that's the first piece of the work that we have been doing, is getting people sort of familiarized with, I think people generally know cell phones and they know WhatsApp, but they really don't understand the technology. Some people don't have, internet. People sometimes chose not to do that because it's an expense, even though it might only be $30 a month or $40 a month. People choose to make decisions that sometimes put them at a disadvantage. So part of what we do is try to help people understand that you've got to do A, B, and C, and you've got to understand this kind of process, not only for yourself, but also for the kids who are in school. And that's part of the challenge that we had with people who came late during the pandemic, is how to get kids registered when the school is providing all of the support virtually. And that was something that we worked with the school board to make sure it happened, but it wasn't easy to do that. That took a bit of time to do that kind of work, and a lot of this takes time. You would think that it would be easier given the situation, but it takes a bit of time to put some of those things in place.
Thank you very much.
With COSTI, all of our services actually have moved online, including the language instruction. But as Chris mentioned, they are on summer break and they will resume in the fall. But again, they will resume virtually. But to get the assessment done, the YMCA is not conducting any assessment in terms of identifying language benchmark, and they are waiting RCC approval. So there is delays in terms of getting people registered or assigned into LINK at this point, but we're hoping by September that issue will be addressed. But I agree with Carl as well, navigating and teaching people to navigate online services have been a challenge. And it's something that we continue supporting our clients, not only the new arrivals, but actually the guards in the community who actually moved out to the community.
Yeah. We're going to be launching, and it'll be open to anybody in the country later this month, a digital literacy community settlement community workshop series of how to teach digital literacy through your phone, only your phone. So how to obtain an email, how to attain a password, how to download Zoom, how to access Zoom. So very, very, very basic pieces. And we intend to share that. We're going to be doing a pilot with a group of illiterate seniors who have cell phones to figure out exactly, how this is going to work. But I put that out there.
Sounds good, Chris.
That sounds amazing. Thank you so much. Christina, is there anything our RSTP is doing in terms of collaboration and future steps?
Thanks, Lorraine. Yeah, and actually, I'm just going to go to the next slide while I talk about this. RSTP is also developing a kind of toolkit checklist to help private sponsors sort through whether or not they have this idea of a credible quarantine plan, along with Michelle's comment that there is a link again to the webinar that was last Wednesday. And on that webinar, Julie from IRCC mentioned to us that IRCC is not the one who's going to be checking the quarantine plan. It is going to be the CBSA officers, and that what they're looking for is something that fits the checklist in this handout that you see on your screen. So as well as the things that Chris went over, which are in your handouts, you also have these slides in your handout, and I made sure to put the web addresses of these PDFs. If you haven't seen these PDFs before, the checklist here that you see for, the mandatory quarantine is the one that Julie recommended. If you're trying to create your own quarantine or self-isolation plan, start with this checklist. The other thing I can tell you is that RSTP trainers are familiarizing themselves with all of the provincial quarantine and self-isolation requirements, as well as when there are some specific city requirements. So please, if you have any questions, do get a hold of your local RSTP trainer. We can connect you with some of those resources. And Chris, can I just check with you that, can you remind me, is the digital literacy information going to be made more widely available? Because I think a lot of us are looking forward to that.
I can send it to you once the curriculum is set for distribution through RSTP. Yep.
That would be amazing. Thank you.
Okay, great. Is there anybody from the audience who would like to raise their hand and speak to possible future collaborations or what they're seeing that they need in terms of resources or best practices? We have a little bit of time left in case anybody would like to do so. Also, just to reiterate, this webinar is being recorded, so the best practices and some of the questions that you may have asked that we didn't have time for, you can direct it to our emails at the end of this PowerPoint presentation. They are there, and we will be sharing best practices afterwards after viewing the recording and the notes. Okay.
I don't see any hands up. So either our three presenters have been brilliant and given everything that everyone needs, which it has been amazing information. I'm really grateful for it for myself. or people are not realizing that.
Shell shocked. What did I get myself into?
Christina, Joyce is asking, when will the RSTP toolkit be available?
So we're just getting final read through from some of our stakeholders. We're looking at trying to make it available by the end of next week. And along with that, we will also have provincially based webinars to help introduce it in case people want to talk about it in real time. So we're looking at end of next week, hopefully.
Okay, thank you very much. Okay, guys, so if you didn't get your question answered, we are unfortunately just running out of time, and would like to thank everybody for attending. You can email us at Michelle Ball or myself at Refugee613 or Christina at RSTP for any unanswered questions. Thank you so much for attending. I'm going to pass the ball over to you, Christina, and thank you.
Great. So because you had to register for this webinar, I do have everyone's email address, and I know that some people don't always get the handouts, so we are going to be emailing out to you a copy of the slides, the 2 documents that Chris went over, as well as I think PDF copies of the federal documents that I showed you here. So that should come to you by email from me within the next couple of business days. If you don't see it, let me know. Other than that, thank you very much, Carl, Chris, and Nawal. It was wonderful hearing from you about your experiences. We really appreciate that you guys have had to forge ahead, and the rest of us are being able to learn from you. Let us know if anything exciting happens. We'll check in with you guys and hopefully continue with our learning about promising practices. And Lorraine and Michelle from ARI, thank you so much for helping organize this presentation. It was very timely. A lot of questions were coming in about it. And to all the attendees who took time on their Monday afternoon, thank you so much for joining us. Let us know by email if you have any more questions.
Thank you all. Have a good day.
Thank you.
Thank you.
Bye
Okay.
now.
Bye-bye.